Thanks for staying with us. Now, in 2011, Ghana recorded some 3 Lassa fever cases, 2 in the Ashanti region and 1 in the eastern region. This was disclosed by Dr. Franklin Esedu-Bekwe, head of the Disease Surveillance Unit of the Ghana Health Service, in an interview with JoyNews. He, however, explained that the recent Lassa fever alert was to create awareness on the need to put in place safety measures to prevent spreading in case of outbreak. Dr. Bekwe said the alert became necessary following reports of an outbreak of Lassa fever in Nigeria, Guinea and Sierra Leone.
Lassa fever is actually a disease which is caused by the Lassa fever virus. So it belongs to a group of diseases that we call them the acute viral hemorrhagic fevers. I think if you look at the name, hemorrhagic is bleeding. So these diseases actually end up with a condition whereby the patients will bleed. And then normally they bleed from several openings, could be from the mouth, from the nose, from the anus, could be from the vagina. So they are a group of conditions that we call them the acute viral hemorrhagic fevers. Apparently, it has an incubation period of between 2 to 21 days, meaning that when somebody is exposed, it may take between that period of time for you to start showing the signs and symptoms. The signs and symptoms actually include 1, fever, because that's why the name is Lassa fever. Yeah, so we have a fever, you may have general malaise, you have joint pains. This could be the early stages. You maybe have a sore throat, you have diarrhea. So you may have a lot of systemic symptoms. Then the end result is when you may have the bleeding tendencies. As I said, you may be bleeding from your openings, the mouth, nose, or other orifices. So those are the presenting complaints. But you get the disease in 2 ways. Is basically you have the virus that exists in a rodent or a rat. It's a particular type of rat that they call mastomys. So that rat actually does not show any disease or any symptoms, but it can transfer the virus to a human being. What it does is that through its secretions, that is through urine or feces, it may deposit the virus on, let's say, food, and then when somebody goes to eat it, then you are exposed. So assuming you have grains like corn or gari spread across in the open, and you leave it, they may have these rats coming and passing urine or feces on it, and you go and eat it, they may get it. So that's one way. So that's why we say that it purely is a zoonotic condition, meaning that you transfer the disease from the animal to human being. There's also another form whereby the person might be diseased, and then through its secretions, you may get the disease. So either through blood or through vomitus or through the feces, I might transfer it to another person. So that's also one form that you can get the disease. Lassa is actually endemic in some countries. It may be endemic in Liberia, in Sierra Leone, in Guinea, and then even in Ghana, we had Lassa cases in 2011. I mean, at that time we had 3 cases in Ghana, 2 in Ashanti region, and 1 in Eastern region. So it is not very, very unknown. But as I said, we can get it in 2 ways, from either the rodent or the rats, or we may get it through a human being. But let me say that we use the alert for a reason. We are not saying that we have Lassa in Ghana. We are saying that we want to make sure sensitize Ghanaians. So the message was to health workers. The idea is that we are sensitizing them so that we alert our preparedness and response to public health emergencies. So we have several thematic areas in our preparedness to address emergencies in Ghana. We have thematic area of surveillance, laboratory diagnosis, case management, risk communication, and coordination. So those are the thematic areas that we use to respond to outbreaks. So since we have the threat of Lassa around us, we said let's activate it. So we activate it in such a way that for surveillance, we have given case definitions to clinicians that be on the lookout for Lassa. So if somebody counts with, let's say, fever, then you need to be thinking, could it be Lassa? You need to ask the right questions and they can get it right. So we are kind of enhancing our sensitivity of our surveillance system. So that's the idea. Then we also said that we have a lab. So when a clinician suspects Lassa, then he takes the blood sample and could be sent to Noguchi. Noguchi is an accredited lab which is global. So even recently they have some samples from Togo to test it. So when we have a suspected case of Lassa, we send it to Noguchi. Then we, following the Ebola, we have support from our partners to improve on infection prevention and control. Lassa, one challenge that we have had is that not in Ghana, other countries, that they have got some health workers who have been affected. So it means that you need to be sure and cautious about how to prevent infection. So in Ghana now, they are doing this mass training of health workers in infection prevention control. So the idea is to sensitize them that they need to be cautious in whatever they are doing. Then the communication. I think that we are in an era of, let me say, a very aggressive press. So we need to make sure we send the right kind of message to the populace that there's no Lassa, but we are alerting Ghanaians that there's a threat around us. We need to be careful. So that if you have a fever, you don't just assume that it's malaria, you go and take anti-malaria or some antibiotic and think that you're fine. It could be a Lassa. In that case, you need to report to a health facility and they'll be taken care of. So that's the import of our alert. And infection prevention is crucial because you may have also people coming to the health facility, and if you are not careful, by you trying to treat them, you may get infected. So the health workers are being trained on infection prevention and control on all other infectious disease conditions. So it's not targeted to Lassa. So this training has been ongoing for the past months, not because of Lassa. It's trying to make sure that health workers are well prepared to prevent infections. What we are doing now is to make sure that our surveillance system is very sensitive. What it does is that if the case should come, if you detect it early, the magnitude is very minimal, then it can be contained. So we call it what containment at source. So it doesn't become a big outbreak. So that is the essence of what we are trying to do with our response system. Yeah, no, Lassa does not have a vaccine, but the good thing is that there's treatment. There's an antiviral agent which can be used to treat case of Lassa. So the best effect is when you report early and it's detected, then it can be treated with the medicine. So there's medicine for Lassa fever.
Okay. So what's in News Desk? It's time for business with Emmanuel Habwajo-Yafi.